Now, among the unknown causes, one of the most thought-provoking, compelling articles that I've read in years has come out of Ottawa in Canada, where Dr. Fuller and his group have suggested that there is a link between the increasing prevalence of obesity in the population and an increased prevalence of focal sclerosis. There is a problem with this paper because obesity is increasing in the population, and maybe you could link anything to the increasing prevalence of obesity. So the actual tie between the obesity and the focal sclerosis has not yet been put together, and it might not be a real thing, but it is something worth thinking about. So nowadays, 7 to 15% of cases of nephrotic syndrome will be caused by focal sclerosis in children. When I worked in Canada in a 17-year period, in a very, very busy clinic, I think we saw 2 or 3 cases of focal sclerosis. And when I crossed the border 19 years ago to come to Philadelphia, I saw all these cases of focal sclerosis, and I thought, did I miss them in Canada? What's going on? And I called my colleagues in Montreal, and they said they hardly ever see focal sclerosis. But what's happened is that in the United States, we think that the prevalence is increasing. The NephCure Foundation perhaps will give us an answer one day, whether it's real or not. And I think in Canada now, they're beginning to see an increase in the prevalence of focal sclerosis, which makes you think about what's going on in the environment to do this. It's a very important and common condition in African Americans, and the outcome and often the presentation is different in African Americans versus Caucasians or white people. And the difference is that we more often see focal sclerosis presenting in an older child who's black without severe nephrotic syndrome, and we are more likely to see recurrence of nephrotic syndrome, of focal sclerosis after transplant in the white child than in a black child. There are these differences, statistical difference that we're seeing. And it tells us that there are environmental and genetic factors at work, but we don't know what they are. So the problems that we face with focal sclerosis is that the patient may be corticosteroid dependent if the patient is fortunate enough to be able to respond to steroids, or corticosteroid resistant. And there are side effects of corticosteroids. There is the concern of progression to end-stage kidney failure, and the concern that the nephrotic syndrome, that the focal sclerosis will recur in about 40% of cases after kidney transplantation. Now, this I lifted from the internet, from an article by Dr. Hildebrand of a patient with focal sclerosis. And we hope never, ever, ever to see a child like this again, in the sense that we do not allow our patients, or the parents do not allow us to allow our patients to become so Cushingoid with the enormous cheeks that this little boy, this child has, and short stature, which you can't see, and many other problems. Fortunately, we are a bit cleverer with steroids than we used to be, and we don't see this as often. So one of the clues that a patient may have focal sclerosis when we do the first biopsy in someone who's not responding to prednisone is that the patient may have larger than normal glomeruli. And we think these glomeruli are larger than normal because their function is greater than normal. We're not sure why their function is greater than normal. I'm going to talk about the function later at Mr. Antosh's request. But if a normal kidney has 100% function, someone with FSGS or minimal change in the early stages will have 150% function. And if you give them large protein diets, the function will go even higher. And we worry that this high function driving the glomerulus is one of the reasons why the scarring may occur. That's been shown quite well in animals, in rats, but not in humans. The other clue to focal sclerosis in someone whose glomeruli look normal is if there were an area here of scarring in this part of the kidney, then we would say there must be a damaged glomerulus somewhere else. Now, I love this, picture. To me, it's one of the most beautiful pictures in the world, except for the real picture of the podocyte. Because I lie awake at night, and when I meditate, I think about the amazing ability of these cells to be what they are and to do what they do. I can only speak about them in poetic terms because I don't have Dr. Holtzman's intelligence and ability to talk about them in scientific terms. But I want to make one important point over here, which I've tried to make to many families with many different diseases in regard to research. People say, why are you doing research on such and such when I want you to do research on my disease? Because my disease is the most important disease in the world. Well, there is a condition known as the congenital nephrotic syndrome. It's inherited from the mother and the father, and it occurs in infants. And it's very rare. We've only seen not too many of these patients. And fortunately, there was a group of scientists in Finland who studied. They were obsessed with this condition because they called it the Finnish disease, and they studied it, and they found that there was this a mutation for this gene, for this gene product, and that literally opened the floodgates into the discovery of all the other abnormalities that are being found. So a condition that only resembled what we're talking about today because of edema and low serum albumin opened the way to all the discoveries that are being made. Now, as far as the treatment of focal sclerosis is concerned, Dr. Pradhan is going to talk about this, and I don't want to steal her talk, but in the case of Cedric, the prednisone was not effective. We gave him pulse solumedrol, which wasn't effective in his case. We gave him endotoxin, which was not effective. We put him onto an ACE inhibitor like ramipril or enalapril, which didn't help in his case. We did not use cyclosporin, and we didn't use Celcet. But what happened to Cedric is that he got a kidney transplant from a relative. But the thing about this boy is that I've left this out of the presentation. His brother presented with nephrotic syndrome at about a year of age and had the same course and also got a kidney transplant. And both brothers have been shown to have mutations in the podocin gene. And both brothers were transplanted, and because they had an inherited form of nephrotic syndrome, we told the parents that there was very little likelihood that the nephrotic syndrome would recur. And the focal sclerosis recurred immediately after the transplant in each case.